Welcome back to the Bugs and Beyond podcast, your one-stop shop for everything infectious diseases. Today we're taking a deep dive into a world that's surprisingly common and way more complex than you might think.
ABSSIs.
Yeah, ABSSIs, or acute bacterial skin and skin structure infections.
That's right.
So these bacterial infections might sound simple. After all, we all get cuts and scrapes, right?
Right.
But they can range from a minor annoyance to a serious medical threat.
Absolutely.
Exactly.
Yeah.
So picture this, you're a healthcare provider and a patient walks in with what looks like a simple skin infection.
Right.
Easy, right? Not so fast.
Nope.
Figuring out the best treatment depends on really understanding what you're dealing with.
Yeah.
And it's trickier than it looks.
Much trickier.
That's why this deep dive is so important. We're going to untangle the web of ABSSIs, learn how to spot them, and explore the latest strategies for tackling them.
Yeah.
And trust me, there are some surprises along the way.
Well, there are definitely some surprises along the way.
Okay, let's unpack this. First, the big picture ABSSSIs are becoming a much bigger problem than they used to be. Between 1997 and 2005, visits related to these infections skyrocketed.
By a whopping 65%.
Wow, 65%? That's incredible.
Yeah, that's not just a statistic.
Oh, no.
That translates into a real burden on healthcare systems. We're talking about longer hospital stays, an average of 6.1 days.
6.1 days.
And eye-watering costs of around $6,830 per episode.
Wow, those numbers are a wake-up call for sure. And it makes you wonder why we're seeing this surge in infections. Is it something about the bacteria themselves?
Well, it's like a microbial whodunit. The culprit often depends on the crime scene, so to speak. Let's break down the two main categories we're dealing with, purulent and non-purulent infections. Think of purulent infections as the ones with the drama. They're the pus-forming infections like those nasty abscesses that make you say, ouch, with every move.
And who's usually behind those dramatic purulent infections?
Often it's our old nemesis, Staphylococcus aureus, especially the methicillin-resistant variety, better known as MRSA. It loves to set up shop and cause those painful pus-filled lesions.
Okay, so that's the pus-filled drama. What about the non-purulent infections? Are they more subtle?
Exactly. Non-purulent infections are the stealthy spreaders. They like to expand their territory, causing redness and swelling, but without the pus. Think of cellulitis, which affects the deeper layers of the skin, or erysipelas, which involves the upper layers and can leave a distinctive shiny raised rash.
So different bacteria, different tactics, different types of trouble. But how do we know who we're dealing with when a patient walks in with a skin infection?
Well, it's all about being a good detective. First, we look for clues at the scene. Is there pus? What does the rash look like? Is it warm and tender? Then we gather intel from the patient. Have they had any recent cuts or scrapes, insect bites? Do they have any medical conditions that might make them more vulnerable? And then we get scientific. Sometimes we need lab tests like a culture to identify the specific bacteria involved.
So we're looking for clues, getting the backstory, running lab tests. But let's rewind a bit and talk about those telltale signs. What are the common symptoms that should raise a red flag for potential ABSSI?
The classic quartet is pain, swelling, warmth, and redness, the hallmarks of inflammation.
Right.
These are our local signs, but we also need to watch for systemic signs like fever, which can signal a more serious infection that's spreading beyond the skin.
Okay, so pain, swelling, warmth, and redness at the site, and fever for a potential systemic issue. But how do we tell those subtle non-purulent infections apart? Erysipelas and cellulitis both involve spreading redness, right?
Right, but they have distinct signatures. Erysipelas likes to make a grand entrance, presenting with those shiny raised lesions that scream, "Look at me!" And sometimes it leaves a calling card. Red streaks radiating out from the infection site, showing how it's spreading along the lymphatic system.
And cellulitis, what's its MO?
Cellulitis is more of a deep cover operative. It affects deeper layers of the skin, so the redness might be less defined and have a darker purplish hue. It can be harder to spot those clear boundaries.
Got it. So we've got our clues and our potential suspects. What's the next step in our detective work? Do we always need a blood culture to crack the case?
Not necessarily. Blood cultures can be helpful, especially in cases where we suspect the infection has spread to the bloodstream. Think of patients with weakened immune systems or those with animal bites. But for many straightforward cases, a blood culture isn't a must-have.
That's good to know. It probably helps put patients at ease, knowing they might not need that extra step.
Absolutely. But remember, thoroughness is key.
Right.
We always need to consider other possibilities that might mimic an ABSSI. For instance, deep vein thrombosis or venous stasis dermatitis can cause similar symptoms, especially if both legs are affected. And never underestimate the power of a good patient history.
Oh, yeah.
Sometimes that spider bite turns out to be something completely different.
Right. Because Dr. Google isn't always the most reliable diagnostician.
Exactly. So we've talked about recognizing the suspects and gathering the evidence. Now let's move on to the intervention phase. How do we treat these bacterial bad guys?
Well, the 2014 IDSA guidelines give us a roadmap for tackling ABSSIs, and they emphasize a tailored approach.
Yes.
The strategy depends on whether the infection is purulent or non-purulent and how severe it is.
That's right. For those milder, non-purulent infections like uncomplicated cellulitis, oral antibiotics are often the go-to.
Okay.
But for more severe cases or those that are spreading quickly, we might need to bring in the big guns, intravenous antibiotics.
And this is where it gets interesting, right? Because the guidelines suggest that a 5-day course of antibiotics can be as effective as a 10-day course for uncomplicated cellulitis. That might surprise some people.
It's a key point that challenges traditional thinking.
Right.
We're moving away from the longer is always better approach to antibiotics and focusing on what the evidence tells us.
So shorter courses can be just as effective in certain cases. Now, what about those dramatic purulent infections? What's our strategy there?
Those usually call for a more hands-on approach. Incision and drainage are often the first line of attack for those abscesses. It's about getting that pus out, cleaning the area, and giving the antibiotics a chance to work their magic.
Makes sense. You got to get the source of the problem out of there.
Yeah.
And then we choose our antibiotic weapon based on the specific bacteria involved, whether it's MSSA or MRSA.
Precisely. A good culture and sensitivity report helps us choose the most effective antibiotic for the job. It's all about targeted treatment.
But even with the best treatment, we can't always guarantee a happy ending. There's always the looming threat of those pesky recurring infections.
Ah, yes, the unwelcome encore.
Yeah.
It's a real challenge. For cellulitis, we see annual recurrence rates of 8–20%.
8 to 20%.
That's a significant number of people who are dealing with repeat infections.
So what can we do to prevent those repeat performances? Is it all about antibiotics?
It's more nuanced than that. Sometimes it's about addressing underlying vulnerabilities that make individuals more susceptible to these infections. Think of conditions like edema, where fluid builds up in the tissues, or obesity, which can create areas of friction and moisture that bacteria love. And let's not forget about eczema, which can disrupt the skin's natural defenses.
So it's not just about zapping the bacteria, it's about looking at the whole picture.
Exactly. And in some cases, prophylactic antibiotics might be recommended to prevent future episodes.
Okay, so prophylactic antibiotics can play a role in some cases, but what about those recurring abscesses? How do we handle those?
With those repeat offenders, we need to investigate further. Could there be an underlying condition at play, like a pilonidal cyst or hidradenitis suppurativa? These conditions can create the perfect environment for abscesses to form again and again.
Those sound pretty serious. What are they exactly?
Pilonidal cysts are those painful bumps that can develop near the tailbone, often caused by ingrown hairs. And hidradenitis suppurativa is a chronic inflammatory skin condition that causes painful lumps and tunnels under the skin.
Wow. Those are conditions that require specialized treatment.
Definitely.
It sounds like we're talking about a multi-pronged approach here.
Addressing
The underlying cause, draining the abscess, and using targeted antibiotics.
Exactly. And in some cases, we might even consider decolonization strategies like intranasal mupirocin or chlorhexidine washes to help reduce the bacterial load on the skin and prevent future infections.
So it's all about being proactive and preventing those unwelcome encores. Now, before we move on, let's put your knowledge to the test with a quick pop quiz. Which of the following is not a typical symptom of a non-purulent ABSSI? A. Pain. B. Fever. C. Pus-filled lesion. D. Red streaks. Take a moment to ponder that one.
I'm sure our listeners are on the case.
All right, time's up. The answer is C. Pus-filled lesion.
That's right.
Remember, those dramatic pus-filled infections are the hallmark of purulent ABSSIs. While the non-purulent infections like erysipelas and cellulitis typically present without pus.
That's an important distinction to remember. It helps highlight the different personalities of these bacterial bad guys.
We've covered a lot of ground in this first part of our deep dive, but the investigation continues. Stay tuned for part 2, where we'll delve even deeper into the world of ABSSIs.
You know what always fascinates me about ABSSIs? It's like a medical detective story.
Yeah.
We have these clinical clues, the redness, the swelling, the pain, and then we have these microbial suspects.
Right.
Figuring out who's responsible and how they're pulling off their act is a real challenge.
It's true. Sometimes those clues can be super subtle, right?
Yeah.
Like, how do you know when a seemingly innocent insect bite is actually something more sinister?
Oh, that's where a keen eye and a good history come in. We have to consider the location of the lesion, the patient's medical history, any potential exposures they might have had. It's all about connecting the dots.
So, for example, someone with diabetes might be more prone to certain types of infections, right?
Absolutely. Diabetic foot ulcers, for instance, can be a breeding ground for a mix of bacteria, making them particularly challenging to treat.
And what about those cases where the infection just doesn't seem to clear up, even with antibiotics? That's got to be frustrating for everyone involved.
That's when we have to consider the possibility of antibiotic resistance. It's a growing problem, and it makes treating these infections even more complex.
Okay, so antibiotic resistance, that's a term we hear a lot these days. But what does it actually mean? How do bacteria become resistant to the drugs that we use to fight them?
Well, it's a bit like an arms race. Bacteria are incredibly adaptable, and they're constantly evolving ways to outsmart our antibiotics.
Wow.
Some bacteria can produce enzymes that break down the antibiotic. Others can change their cell walls to prevent the antibiotic from entering, and some can even pump the antibiotic out of the cell.
Wow, so they've got all these tricks up their sleeve.
They do. They're very clever.
So what's the solution? Do we just keep developing stronger and stronger antibiotics?
It's not that simple. The more we use antibiotics, the more we drive the development of resistance.
Right.
It's a vicious cycle.
So we're in this constant battle trying to stay one step ahead of these superbugs. What can we do to turn the tide?
We need a multi-pronged approach. First and foremost, we need to be smarter about how we use antibiotics.
Okay.
That means prescribing them only when they're truly necessary and making sure patients understand the importance of completing their full course of treatment.
So no more antibiotics for every sniffle.
Exactly. We need to reserve these powerful drugs for the situations where they're truly needed.
Right. And we need to educate patients about the importance of following their doctor's instructions.
Absolutely.
Right. No stopping the antibiotics just because you start feeling better.
Absolutely. That's a crucial message. Every time we misuse antibiotics, we're essentially giving bacteria a training session on how to become resistant.
Okay. So we need to be more judicious with our antibiotic use.
Yeah.
What else can we do to combat this resistance problem?
Well, beyond responsible prescribing practices, we also need to invest in the research and development of new antibiotics and alternative treatment strategies.
Like what? What are some of the exciting things on the horizon?
One promising area is phage therapy.
Phage therapy.
It sounds like something out of a sci-fi movie, but it's actually a very old concept.
Phage therapy. Tell me more.
Phages are viruses that infect and kill bacteria.
Okay.
They've been around for billions of years, and we're just now starting to harness their potential to fight bacterial infections.
So we're using viruses to fight bacteria.
We are.
That's pretty mind-blowing.
It is. And the beauty of phage therapy is that phages are very specific.
Okay.
They target only certain types of bacteria, so they're less likely to disrupt the body's natural microbiome.
Okay, so that's one weapon in our arsenal. What about other approaches like using antibodies or probiotics?
Those are definitely areas of active research. Antibodies can be engineered to target specific bacteria, and probiotics can help restore the balance of good bacteria in the gut, which can be disrupted by antibiotic use.
So it's not just about killing the bad guys, it's also about supporting the good guys.
Exactly. It's all about maintaining a healthy microbiome. That's a key principle in modern medicine.
This is all so fascinating. I feel like we could talk about this for hours.
Me too.
But we do need to move on. We've talked about the challenges of antibiotic resistance, but there's another aspect of ABSSIs that we need to address. Those pesky recurring infections.
Right. We touched on this earlier, but it's worth diving deeper.
Yeah,
Those recurrence rates are nothing to sneeze at.
definitely. Understanding why these infections come back is crucial for effective management. So let's start with non-purulent infections like cellulitis. Why do they tend to recur in some people?
Often it's about underlying conditions that make the skin more vulnerable to infection.
Right.
Things like edema, where fluid builds up in the tissues, can create a perfect environment for bacteria to thrive.
So edema is like a welcome mat for bacteria.
In a way, yes. The excess fluid provides a cozy environment for them to multiply.
And obesity can play a role too, right?
Yes.
I can see how extra skin folds could create those warm, moist areas that bacteria love.
You're exactly right. Obesity can lead to skin folds and areas of friction, which can trap moisture and bacteria.
And we can't forget about eczema, which can disrupt the skin's natural barrier function.
Right.
It's like having a chink in the armor, right?
Precisely. Eczema can create cracks and fissures in the skin, making it easier for bacteria to invade.
So it's not just about treating the infection itself, it's also about addressing these underlying conditions.
Yeah.
It's like fixing the leaky roof instead of just mopping up the water.
That's a great analogy. And in some cases, prophylactic antibiotics might be recommended to prevent future episodes.
Prophylactic antibiotics. So taking antibiotics even when you don't have an active infection.
Yes, but only in specific cases where the risk of recurrence is high. It's a decision that should be made in consultation with a healthcare provider, weighing the potential benefits against the risks.
Okay, that makes sense. So we've covered non-purulent infections. What about recurrent abscesses? What's the story there?
Well, those can be a bit trickier. Sometimes there's an underlying cause that needs to be addressed, like a pilonidal cyst or hidradenitis suppurativa.
Those sound intense. Can you break those down for us?
Sure. Pilonidal cysts are those painful bumps that can develop near the tailbone, often caused by ingrown hairs.
Oh.
And hidradenitis suppurativa is a chronic inflammatory skin condition that causes painful lumps and tunnels under the skin.
Wow. So those are conditions that require specialized treatment. It's not just about popping the abscess and calling it a day.
Right, we need to address the root of the problem.
And in cases of recurrent abscesses, we always want to make sure we get a good culture to identify the specific bacteria involved and choose the most appropriate antibiotic right. No point in using a shotgun when you need a sniper rifle.
Exactly. Targeted treatment is key. And we might even consider those decolonization strategies we talked about earlier, like intranasal mupirocin or chlorhexidine washes. They can help reduce the bacterial load on the skin and potentially prevent future infections.
So it's all about being proactive and staying ahead of those bacterial bad guys.
Precisely.
This has been such an enlightening conversation. I feel like we've only just scratched the surface of this complex topic.
I agree. But unfortunately, we're running out of time for this segment. We'll have to continue our exploration of ABSSIs in part 3 of our deep dive.
And we are back for the final part of our deep dive on ABSSIs.
Part 3.
So, we've journeyed through all the different types of infections, learned how to spot those bacterial troublemakers, and, explored all those treatment strategies.
We have. It's been quite the adventure, hasn't it?
It has. And we've seen just how complex and challenging these infections can be. But before we wrap up our investigation, I want to shift our focus from the individual patient to the bigger picture, the public health perspective.
Okay.
So let's zoom out and look at ABSSIs through a wider lens. What are the implications of these infections for public health? What should we be concerned about?
Well, one major concern is the rise of a particular bacterial villain, community-acquired MRSA. We used to think of MRSA as primarily a hospital-acquired infection, something you pick up during a hospital stay, but now it's increasingly common out in the community.
So people can get MRSA even if they haven't been in a hospital.
Exactly.
How does that happen?
Well, it can spread through close contact with someone who's carrying MRSA, through contact with contaminated surfaces, or even by sharing personal items like towels or sports equipment.
Oh, wow, that's concerning.
Yeah.
It seems like MRSA is lurking everywhere. So what can we do to protect ourselves and prevent it from spreading in the community?
Well, good hand hygiene is our first line of defense.
Of course.
Wash your hands frequently with soap and water, or use an alcohol-based hand sanitizer. And avoid sharing personal items like towels, razors, or athletic gear. It's all about breaking the chain of transmission.
It sounds like those basic hygiene practices we learned as kids are still some of the best weapons in our arsenal.
Absolutely. They're simple but effective. And if you have a cut or scrape, make sure to keep it clean and covered to prevent infection. It's about giving those bacterial bad guys fewer opportunities to set up shop.
Okay, so hygiene is key. What else should we be thinking about from a public health perspective?
Well, we've talked a lot about antibiotic resistance, but it's worth emphasizing again because it's a major threat to public health. The more we overuse and misuse antibiotics, the more we're fueling the development of those superbugs, bacteria that are resistant to multiple antibiotics.
And that has implications not just for ABSSIs, but for all kinds of infections, right? We're talking about a global health crisis.
Yeah. Exactly. Antibiotic resistance is a global problem, and it requires a coordinated effort from healthcare providers, policymakers, and the public to address it. We need to promote responsible antibiotic use, invest in research and development of new antibiotics, and explore alternative treatment strategies.
So it sounds like we need an all-hands-on-deck approach to tackle this antibiotic resistance challenge. Now, before we wrap up, I want to bring us back to that initial scenario we presented, the healthcare provider faced with a patient who has a skin infection. What are some key takeaways for those on the front lines of ABSSSI care?
I'd say the most important thing is to have a high index of suspicion. Don't assume that every skin infection is simple or straightforward.
Right.
Take a thorough history, perform a careful physical exam, and consider the possibility of both common and less common pathogens. Remember, we're medical detectives, and sometimes those clues can be subtle.
So it's about being thorough, asking the right questions, and not jumping to conclusions.
Exactly. And don't hesitate to consult with an infectious diseases specialist if you have any doubts or if the infection isn't responding as expected. It's always better to get a second opinion and ensure that the patient is getting the most appropriate care.
It's about teamwork and collaboration, right?
It is.
Bringing in the specialists when needed to provide the best possible care for the patient.
Precisely. Early recognition and appropriate treatment are key to preventing complications and ensuring the best outcomes for our patients.
Well, I think we've covered just about everything we can on ABSSIs for one episode. We've explored all the different types, delved into the causes and the risk factors, discussed the challenges of diagnosis and treatment. Plus, we touched on the public health implications of these infections and the importance of antibiotic stewardship. It's been quite a comprehensive deep dive.
It certainly has. And I hope our listeners now have a deeper understanding of these often overlooked infections. They may seem simple, but they can quickly become complex and challenging to manage.
Absolutely. ABSSIs might start small, but they can escalate quickly if not addressed promptly and properly. So remember, folks, if you suspect you might have a skin infection, don't hesitate to seek medical attention. Early intervention is key to a good outcome. And thanks for joining us on this fascinating journey into the world of bugs and beyond. We'll catch you next time for another deep dive into the realm of infectious diseases.